Intramuscular Injection, Procedure and Nursing Care. Welcome to our comprehensive guide on the intramuscular injection procedure and nursing care. In this video, we'll walk you through the essential steps and best practices to ensure a safe and effective administration of intramuscular injections. Hi, I'm Nurse Emily. Intramuscular injections are a common method for delivering medications deep into the muscle tissue, allowing for quick absorption into the bloodstream. They're often used for vaccines, antibiotics, and other medications. Let's start by discussing the supplies you'll need. You'll need the appropriate syringe and needle, an alcohol swab, the medication to be administered, gloves, a cotton ball or gauze, and a sharps disposal container. Now, let's move on to the preparation. Always start by washing your hands thoroughly. Next, don your gloves to maintain a sterile environment. Check the medication vial for the correct drug and expiration date. Wipe the top of the vial with an alcohol swab to disinfect it. Draw the medication into the syringe and ensure there are no air bubbles. Double-check the dose before proceeding. Common sites for intramuscular injections include the deltoid muscle in the upper arm, the vastus lateralis muscle in the thigh, and the ventrogluteal and dorsogluteal muscles in the buttocks. For this demonstration, we'll use the deltoid muscle. Make sure to choose a site free of infection, scars, or any other abnormalities. Clean the injection site with an alcohol swab, starting at the center and moving outward in a circular motion. Hold the syringe like a dart and insert the needle at a 90-degree angle with a quick, firm motion. Aspirate to ensure you're not in a blood vessel, then slowly inject the medication. Once done, withdraw the needle swiftly and apply a cotton ball or gauze to the site. Dispose of the needle safely in a sharp container and remove your gloves. Wash your hands again to maintain hygiene. Apply a bandage if needed. Inform the patient about potential side effects and advise them to monitor the site for any signs of infection. And that's it. Following these steps will help ensure a safe and effective intramuscular injection procedure. Thank you for watching, and remember, always follow your healthcare facility's protocols and guidelines. Thank you for watching. Subscribe for more nursing tutorials. For more nursing tutorials and healthcare tips, don't forget to subscribe to our channel. Stay safe and keep providing excellent care.